Welcome back to Ozarks Fox AM. We are very happy to have my doctor in studio today, Dr. Luke Van Kirk from Command Family Medicine. Now, if you joined us earlier, we were talking all about COVID-19, and there's so much to discuss.
Right.
Of course, we want to have you back because we have so many questions, and it's great to have a medical expert here
Absolutely.
to discuss it. Now, before we left off last time, we said, if you have the symptoms, there's no cure, and you send people home to self-quarantine, what's the best treatment to do to survive?
Yeah, unfortunately, with viruses like this, there's not a whole lot we can do treatment-wise. It's more symptomatic, and so. But some things to avoid, actually, from what we're seeing with some evidence coming out, is actually avoiding ibuprofen is the main one over the counter. So
I had no idea.
Other cough and cold remedies are okay. Mucinex and Tylenol and that type of thing. But if you're concerned you may have it or you test positive for it, then ibuprofen is one thing to make sure.
This is the first time I've heard this.
Yeah, me too.
I have taken some Tylenol lately, but that is not ibuprofen. So there's a difference there. Okay,
Tylenol's
good information.
okay.
Information. Would you say taking vitamins, drinking water, is any of that helpful, or is it not going to do anything?
Yeah, on the front end, there's some good evidence for zinc particularly, and so we've been selling a lot of that at the office lately. That helps inhibit the virus from replicating. So we've been recommending people just take some zinc daily, and then if you do get symptoms, then you can up the dose. So things like Zicam can be helpful to limit symptoms.
I've been getting the zinc ones that you put in your nose.
Oh,
I've been doing that every morning before, because honestly, I mean, that's one way that it can enter, and so I think that's a great way
That's really smart.
help.
Yeah. And what about the actual tests? I know some states, some practices are limited on the number of tests you have. Why are there so few tests? And is it because it's so new, there are not enough tests? And when you're testing it, what makes it look different than the regular flu? How do you know?
Right, yeah, so the issue with the tests is that we haven't had to, this is a new virus, we haven't had to test in quantities like this before for it, so we didn't have, we don't have a rapid test set up yet. There's a lot of different companies working on that, and so hopefully we'll have a rapid test come out soon. Right now, I think the turnaround time, Quest has got it down to like a day and a half, which is pretty decent. It was 4 to 5 days. And so, but we just don't have a lot of the kits that we need to do the testing. And so that's why we're right now limiting it to mainly symptomatic people that are either higher risk if they're in the hospital, but or if they have known contact, those types of things.
Okay.
Haven't you? I feel like people are really heroic. Yourself being a doctor, and people are stepping up to help this issue that's going on right now. I mean, I know they're concerned about their own health, and they should be, and they're taking precautions. But I just love the vibe of people really wanting to get out there and serve the people and help this to go away.
Yeah, that's been great to see, especially with the restaurants. I can't imagine being in the restaurant business right now, and if you're a server and those types of things. So the people that are helping to push that
on
and
the front
support,
lines.
support those local businesses.
Well, I think we posted yesterday that he was going to be on the show, so we have some viewer questions about COVID-19.
Okay.
Let's take a look at some of the questions. And Dr. Luke, these are just from the viewers. These are what people at home are thinking. Sherry Welch says, do they know if one person has had the COVID-19, are they immune to get it again? So if they get it and they get cured, can they get it again?
We don't know that right now. It depends on how the virus behaves, and we don't know that. With the flu, so you can get the flu again. It mutates and it changes. So if it mutates like the flu does, then there's a possibility you could get reinfected. But that's something we don't know just yet.
Yeah.
All right. Thank you, Sherry. Our next question is from Karen, who said, "How contagious is the virus?"
So it's not as contagious as something like the measles. Measles, if you were to get that, on average, people infect, I think, about 14 other people if you get measles.
Really?
With the coronavirus, with this coronavirus, from what they're seeing, it's about 2.5 to 3.5 people that you'd infect if you're contagious. But with the social distancing, I was actually just looking at a graphic before we started that came out that if you decrease your contact with other people by 50%, obviously that cuts it down to half. You're gonna maybe 1.6 or so people you'll infect, and then if you do 75%, then it's less than 1 that you're going to be infecting per infected person. And then if you extrapolate that out over a 30-day time window, it really cuts down the amount of people that each infected person is going to.
And Kelly, you had a question for the show that I liked. We were talking in the green room about breathing versus touching and how long it is in the air and how close you have to be.
Right.
And you were saying something about personal contact is the highest risk, just the actual personal touching.
Yeah,
that's what we're saying. Yeah, person-to-person contact. Obviously there's concern about being on surfaces, but that the 6 to 10 foot window is kind of what we're going by right now. But we don't know. There's some more information coming out that maybe it is airborne as well, and so we're learning every day and updating as we can.
So what if you're at Walmart, you're out shopping? I mean, when you're in amongst some people, I mean, do we need to change our clothes when we get home? I mean, I know that sounds crazy, but I'm just asking that question.
I mean, if you can avoid going there altogether, that's probably the best.
So,
I know there are probably the Walmart pickups and deliveries and that kind of thing are probably
option.
I know my wife has been looking to see the pickup options, and they're just
they're gone.
There's
so you're
not much you can do. But
if
you can avoid getting out right now, especially in the next week and a half, 2 weeks, we're kind of in a critical window here. If you can avoid that, I would. Otherwise, if you can be just not, and the close contact issue is more, there's a time aspect to it. And so it's not just, if you walked by somebody, that's not going to be significant enough. But it's more being close to somebody for at least 10 minutes, usually in an indoor environment, that you're going to be more likely to be at risk. So if you just walk by somebody at Walmart, it's probably not going to be significant.
Oh, good. Well, that's good to know.
And people are paranoid, I know, because when I was shopping yesterday, some guy was coughing, and then all the eyes go to him.
Yeah, it's true.
And then he's like, boy, this smoker's cough really gets old. And I'm like, you know what I mean? So, people are a little paranoid.
Yep.
Yeah.
We have a couple viewer questions left. Let's get to those before we run out of time. Cheryl says, now I've heard this virus cannot survive above 56 degrees and our body temps are warmer, so how is this happening? That's a good question because, you think about the virus not surviving summertime, which is warmer temperatures. So I don't understand this question, but...
Yeah, I mean, with the body temperature thing, it's more tied to what the outdoor environment is. It's in our body. We're its host, and we're providing it, what it needs to survive. So the temperature's not as much of an issue as when it's outdoors and it doesn't have a host that it's infecting, is where the temperature comes into play.
I gotcha.
And I don't know that we know exactly that, if it's above 56 degrees. I think it's what we're hoping and what's similar with other respiratory viruses.
All right, and we have one more question, I think, just one left, and it is from Cindy, who said, if you currently have bronchitis, are you more susceptible to get it? And if you work in a public place like Walmart and they give you time off, is it wise to just take it?
Yeah, if they're willing to give you time off, and you're somebody that's at risk, if you're currently sick, your immune system's going to be down, so you be more susceptible to catching it. And so, if they'll give you paid time off, right now would be a good time to take that.
I would suggest that as well.
Okay.
Kelly's thinking about it. Do I get paid time off?
Well,
I do want to give a huge shout out really fast because I love Dr. Luke and his whole team at Command Family Medicine. So I want to say a huge shout out to Dr. Tex and Sam and Nurse Natalie and just everybody at your facility for being on the front lines of this. They're putting themselves at risk every single day to help us in our community. And I am so thankful I switched to you because I do have my doctor's cell phone and I can text him anytime. And if I have a cough or anything, so I appreciate the services you're providing, Dr. Luke.
Thanks.
Thank you for coming in today. We appreciate
thanks for having me.
All right, coming up, we will have our friends at Intrigue Journal. We'll be back after this.
I seriously have 1,000 more questions. We could seriously talk for 2 more hours.
Yeah.
I could